Hey everybody, it's Elisa, and I am going to talk to you guys about my cystic fibrosis. So I've gotten asked a couple questions about my cystic fibrosis, and I would just like to explain it to you guys, and I want to be open and honest with all my subscribers. So I'm just going to answer a few questions, and at the end I'm going to give you a website with more information and whatnot. And if you guys want any more information on cystic fibrosis, just ask me. If you guys want more questions answered, I'd love to do another video. So starting with the first question is, what is cystic fibrosis? And I'm going to go ahead and give you the actual technical definition for this right now, just because it's just stupid to explain off my head. So according to cff.org, cystic fibrosis is a life-threatening genetic disease that causes mucus to build up and clog some of the organs in the body, particularly the lungs and pancreas. When mucus clogs the lungs, it can make breathing very difficult. The thick, sticky mucus also causes bacteria to get stuck in the airways, which causes inflammation and infections that lead to lung damage. Mucus can also block the digestive tract and the pancreas. The mucus stops the digestive enzymes from getting to the intestines. The body needs these enzymes to break down the food, which provides important nutrients to help people grow and stay healthy. People with cystic fibrosis often need to replace these enzymes with medicine that they take with their meals and snacks, which helps them digest their food and get proper nutrition. Okay, and hopefully throughout these other questions you can kind of see what all that means. So question number 2 is, what do I do to keep myself healthy? Well, when you have cystic fibrosis, usually you have to take treatments, which consist of nebulizers, and there's various medicines that you can take for that, and it also consists of any kind of airway clearance. And I personally do the vest, which a lot of you I'm sure are familiar with. And then there's also the IPV, there's an acapella, there's the flutter valve, and then there's manual CPT. All these can be done in the hospital, and there's a lot of people choose different ways for different reasons, whatever the patient is most comfortable with. So when I do my nebulizers, I take albuterol, which people with asthma also take, and it is a bronchodilator, and it's actually duo neb. It's albuterol and Atrovent together. And then I take Pulmozyme once a night, and Pulmozyme is a medicine that's based off of sugar, and what it does is it thins down the mucus, and it makes it easier to bring up because our mucus is abnormally thick. And then I also take, at times, not every day, hypertonic saline, which kind of irritates the airways and makes you cough to get everything up, because you need to get it up. It's important when you have CF to get everything out of your lungs up, or as much as you can, because you don't want that bacteria and that mucus all sitting there and harboring, because they're going to have a big freaking party and they're going to screw you up. So if you have CF, you need to get that shit out. And then that's all I take, and I'm actually going to start 1 month on, 1 month off Colistin, and there's Colistin, there's tobramycin, or Toby, I'm sorry, and there is Caistin, and Caistin's a new drug, but they're basically all the same concept. 1 month on, 1 month off, I think. I don't know what Caistin is for sure, and they just kind of help you keep away from getting the Pseudomonas, which is one of the bacteria in your lungs. It just kind of makes it so it stays dormant and doesn't flare up. And don't hold me responsible for all these answers to the questions. I'm just telling you how I know it. So that's the medicine I take for my lungs, and I also take azithromycin, which is a antibiotic orally for my lungs, which is an anti-inflammatory and it basically makes it so my lungs don't get inflamed and irritated. And then that's pretty much all I take for my lungs that I can think of off the top of my head. And yeah, so, and then for my pancreas, I have to take digestive enzymes every time I eat. And then I also have to take Miralax twice a day, and a lot of people think Miralax, haha, that gives you diarrhea. No, it doesn't. It actually just keeps you normal and keeps your bowels going at a normal pace, because people with cystic fibrosis can actually get in like blockages in their intestines, and it can lead to bad things, and you could wind up getting half your intestines cut out. Whatever is painful, you don't want it, so you gotta just make sure that's all on track. And that's pretty much all I do for my stomach. I don't really have many stomach problems, but there are a lot more people, unfortunately, that do have a lot of stomach problems. A lot of people have G-tubes too, where they can be fed at night, so they don't have to deal with trying to eat and gain all the weight during the day, and it helps them at night. Occasionally, I will drink Carnation Instant Breakfast, Boost, Ensure, all those old people drinks to help me gain weight. Sometimes I'll buy muscle milk, protein shakes, and then I also get probiotics at GNC just to kind of restore the natural flora or whatever that's in my body, so I don't get stomach aches, whatever. And you really need to make sure that you have probiotics when you're on antibiotics, because it can destroy the bad cells and the good cells, and you don't want to destroy the good cells. So the next question is, does it hurt? There are some times that it hurts, and there are some times that it doesn't hurt. My cystic fibrosis makes my joints hurt really bad, and sometimes I have to take pain medicine for them. I have good days and bad days, and I never really have a lot of pain in my lungs. I don't really have a lot of pains in my stomach, but sometimes it can hurt, and it sucks. But, I mean, that's life. What parts of the body does CF affect? Like, it says it affects your lungs and it affects your pancreas. Sorry if I'm going really fast. I only have 10 minutes, and I have, like, a couple more questions I have to answer. So it affects your lungs, your pancreas, but as you get older, it can also affect a lot of things. You can get CFRD, which is cystic fibrosis-related diabetes, and if you have diabetes, that can affect a whole other different parts of your body that I am not going to talk about because I don't have that. You can look it up on Google, though. We can get cystic fibrosis, arthritis, which is why my joints hurt so bad sometimes, and you can get sinus problems. A lot of people have sinus problems. I think I'm starting to get them. So then you have to go to ENT, get your ears, nose, throat checked out. So it can affect that, and it can affect a lot of things, but mainly lungs and pancreas. Do you go to the hospital a lot? I do go to the hospital a lot lately. On average, I would say I go about 3 times a year. But this past 2 years, I have been in and out of the hospital probably every 2 to 3 months. So it's really sucked, and I'm trying to get out of that stage. What kind of treatment is there? There's always clinical trials, and there's always clinical trials going on, plus all the treatments that I told you, and yeah, so that question's kind of already answered. Has anything good ever come out of having CF? Yes, I have met some really, really amazing people, be them doctors, be them nurses, people, kind people. I have met amazing people with cystic fibrosis, and let me tell you, I've never learned more about cystic fibrosis I've never learned more from anybody else but people with CF. They have been the most helpful people in my life. I don't even think a doctor can tell you what a person with CF can tell you. I don't know what I would do without them. And that is just the most amazing thing that has come out of CF. The worst thing about CF, to me personally, is losing friends, be it losing them because they can't deal with you being sick all the time, which has happened, and you know what? Fuck you. That's all I can say about that. And also losing friends to CF, them having CF and dying. Yes, CF is fatal, and if you don't take care of yourself, you can die. Whole nother subject, but that's true. So, yeah, that's one thing that is horrible about having CF. And, oh crap, oh no, I lost my list, and it's 9:22. What's the worst? Oh, I already said that. And where can I find out more? You can go to www.cff.org. You can go to www.cf2chat.com, which is a great forum. You can go to www.cysticfibrosis.com, I believe. You can go to www.cfvoice.com, I think. I don't know if I'm getting the ends right. I'll put all the links and everything in the down bar, plus on a slide thing at the end of this. So if you have any more questions or anything, I'd love to help you out. I do another video in a couple of them. So to learn more about cystic fibrosis, go to any of these links. Have a great day.